Because the motion has been passed, you resume your seat. The mover to reply. Mover. Yes, Honorable Fatuma.
Mr. Speaker, I find the honorable member standing to be disrespectful to your seat and to other members. I think we are all elected, we are all MPs of equal nature. If a decision has been made in this House, he should respect the decision of the majority. May we proceed and may he respect the decision that has been made. Thank you, Mr. Speaker.
Thank you. Mover.
Honorable Speaker, in reply, I would like to say that this is an important bill for the nation. We need to streamline health facilities in this country and the health laws in this country to give this country a new regime in management of facilities. And therefore, Honorable Speaker, I beg to reply.
Thank you so much, Honorable Baya. For obvious reasons, I will call the next order.
Order number 14, the Primary Healthcare Bill, Senate Bill number 44 of 2023, second reading.
Majority Leader, who is moving? This is the Majority Whip. Go ahead.
Thank you, Honorable Speaker. Honorable Speaker, I beg to move that the Primary Healthcare Bill, 2023, Senate Bill number 44 of 2023, be read for the second time. Honorable Speaker, as you're aware, the bill is aligned to the Constitution of Kenya 2010 as it facilitates the progressive realization of the right to the highest attainment standard of health, including the right of the health care services guaranteed under Article 43, 1A, Article 21(2) of the Constitution, and requires the state to take legislative, policy, and other measures to achieve the progressive realization of the rights guaranteed in Article 43. The bill therefore facilitates the fulfillment of this obligation by both levels of government as it makes healthcare frameworks in the country responsive to the unique health needs of the Kenyan population in each county and sub-county in furtherance of devolution. Honorable Speaker, indeed, primary health care is essential in ensuring that all Kenyans not only access good quality health care, but also fully participate in the management of their specific health needs. In this regard, the bill provides for community health care services, commencing at the household level, and facility health care services starting from the community, dispensaries, and the health centers, with all linking to the hospitals to form a network of practice. Further, the bill is aligned to the Health Act number 21 of 2017, which is the principal law on health matters in the country. Honorable Speaker, the first schedule to the Health Act number 21 of 2017 recognizes community health services at level 1, and it's managed by the community health extension workers. And the bill therefore strengthens these levels 1 services, as community health promoters are important players in the health sector as they deal directly with the community. They are also familiar with the households in their areas of residence as well as the language of the people, because they are picked from the community, Honorable Speaker. Community health promoters will therefore greatly assist in preventive care, as by going door to door, they will be able to identify the people in need of healthcare services before their health conditions escalate. Because these are their aunts, these are their sisters, they are their brothers, they are their relatives, and they are picked from that very community. And it's very easy to identify who is sick and who is not. Honorable Speaker, the bill aims to establish a framework for the delivery of access to and management of primary health care through creation of an elaborate primary health care network at each county and sub-county level for equitable distribution of resources and healthcare services. This is in line with the Kenya Health Financing Strategy 2020 to 2030, which is aimed at ensuring that the financing of healthcare services is done in a fair and efficient manner for the benefit of all Kenyans. Honorable Speaker, the bill has 25 clauses, and it seeks to provide a framework for the delivery of access to management of primary health care in the country. The bill also creates an elaborate primary health care network at each county and sub-county level to ensure equitable distribution of resources and health services. The bill further proposes the establishment of county primary health care advisory committee that are mandated to ensure the effective implementation of primary health care through resource mobilization and advocacy and the planning and development of primary health care service delivery. And of course, this committee, Honorable Speaker, is also picked from among the community members of that very particular county. Honorable Speaker, Part 1 of Clause 1 to 3 of the bill provides for the preliminary provisions and outline the objections of the bill, which are, number 1, or A, promote and fulfill the rights of all persons in Kenya towards a progressive realization of their right to the highest sustainable standard of health care. B, promote the implementation of primary health care through a systematic approach and clear delineation of roles of the stakeholders, all the stakeholders towards the realization of universal health care coverage. C, Honorable Speaker, provides for the establishment of primary health care networks, community health units, and other stakeholders centered in engagement forums for sustainable provision of primary health care services. D, Honorable Speaker, it also provides for the role of the multidisciplinary team in the provisions of the primary health care services. And finally, E, provides for the role of community health officers. You know, it defines their roles. It defines the role of the community health assistants. It also defines the community health promoters in the provision of community-based primary health care services. Honorable Speaker, Part 2, Clauses 4 to 7, Honorable Speaker, of the bill details the primary health care services that are accessible at the community level and in the health facilities. The bill in Clause 7, Honorable Speaker, mandates the county governments to facilitate the delivery of these services by, and this is very important because health is now fully devolved. So the county governments is mandated to deliver these services by, number 1, adopting a supportive and innovative modern approaches for disease identification, monitoring, surveillance, early warning, research, community education, and information sharing. That is the responsibility of the county government. To also provide, they should also be providing the community and stakeholder support to the respective primary health care facilities to facilitate optimal service provision. Honorable Speaker, they also are supposed to enhance the availability of quality services, accessibility and predictability of standardized primary health care services through effective leadership and governance, resourcing private-public partnerships, sharing of essential health products and technologies, and integrated health information systems. Honorable Speaker, they are also supposed to ensure that there is continuous community engagement. Of course, this now includes training and registration of households within communities, within their units, within the community health units in each primary health care network. And finally, Honorable Speaker, they are also supposed, and that is the county government, they are supposed to guarantee that primary health care services are optimally financed and resourced to offer quality care to all patients and residents in the Republic of Kenya. Honorable Speaker, Part 3, which is Clause 8 to 13 of the bill, provides for the establishment of the primary health care workforce, which includes community health promoters and healthcare providers. The part also sets out the modalities on the selection and recruitment of community health promoters by the county government, as well as the obligations of the county government in relation to county health promoters. Honorable Speaker, even as I present this, because this is a matter that is fully devolved, I don't know whether it's by coincidence. I have about 2 chief officers in my office now watching and following to see their particular responsibility as far as this whole thing is concerned. So under the bill, I need to inform them because they are watching, and that is the chief officer for Nairobi, Musiria, that under the bill, a community health promoter shall be selected by the community through a public participation forum and appointed by the county government. And to qualify for such a selection and appointment as a community health promoter under Clause 9, a person must be a Kenyan citizen. He must have attained the age of 18 years, and that is the majority age in the other language. Must be of sound mind. Must be responsible and respected member of the community. Must be able to understand the role of the community health promoter and be a resident of the respective community for a continuous period of not less than 5 years prior to the appointment date. Because the purpose of this whole thing is to make sure that every person, I mean, those people who are selected or given this job are people who understand that area very well, so that you don't get people who do not understand that there is a sick patient here who needs care. So this person must also be literate and can read and write in at least one of the national languages and the local language. And must have not been disqualified for appointment. On a light note, Honorable Speaker, if this was an application for Honorable Rene Mayaka, she wouldn't qualify under G because she's still learning the local language. And must not have been disqualified for appointment to office by the above. But she qualifies in Nairobi.
Honorable Osoro, the Honorable Rene speaks very good Luo. Which local language are you talking about?
She speaks very good Luo. Yeah,
language?
You are right.
Which local language?
You are right. She speaks very good Luo. Yeah, you are right. She's called Mayaka, not Kisi. I have not been able to, this person must have not been disqualified for appointment to office by the above criteria or by any other law. No, but you qualify in Nairobi. Honorable Speaker, Part 4 of Clause 14 to 15 of the bill details the role of national government in primary health care policy and the financing of primary health care functions by the national government in accordance with the law relating to county government's additional allocations. The additional resources allocated by the national government shall be a supplement and not a substitute. And this must be very clear. It's a supplement and not a substitute of the resources allocated by the respective county governments. Honorable Speaker, Part 5, which is clauses 16 to 21 of the bill, contains provisions on the management of primary health care services. The bill provides for the roles of the county governments and the functions of the various administrative committees established in the bill. The committees are the County Primary Health Care Advisory Committee, that is what this part provides for, the Primary Health Care Network Committees, just 3 committees, and finally, the Community Health Committee. That is also provided in clauses 17, 19, and 21 of the bill, respectively. Honorable Speaker, Part 10 of the bill is clauses 22 to 25. And that very particular part provides for the miscellaneous provisions, including transitional provisions. It also provides for offenses. It provides for penalties, regulations, and compliance with the Data Protection Act of 2019. Of course, for purposes of protecting the rights of the subjects. Honorable Speaker, as I conclude, this bill is in line with the government's priority of using primary health care and seeks to ensure that all Kenyans have access to affordable and comprehensive quality health services right from the primary level of care. That the presumption of having patients, a patient very, very sick, deep in the villages, transferred all the way without a basic primary health care to Kenyatta National Hospital or a hospital that is nearby, in some town should be a thing of the past. That the community health care officers will handle that, will have skills to handle that person right from the village, even as they bring that person or have that person brought to the hospital for further care. So this will also reduce the disease burden by such people, and the current high cost of out-of-pocket expenditure on healthcare, as there will be early detection of diseases, especially chronic illness. With the basic knowledge, of course, some people develop diseases like diabetes without knowledge, without their knowledge that they are sick. And when it's detected, you find it's a little bit late to manage. So these community healthcare workers will be able to help because they'll have that basic information by the mere fact that they'll know they have small clusters of management. They can be able to manage about 5, 10, or 15 households. They'll be able to know that the signs I saw in this person, as the signs that I was taught on as symptoms of diabetes, for instance, and they'll start that very primary care from that particular section. So, Honorable Speaker, with those very, very many remarks, I beg to move and ask, with tremendous respect, Honorable Rocco to second.
You're allowed to ask Honorable Koze for notes.
Thank you, Mr. Speaker. And we don't want to turn this parliament into a kangaroo